And for those of us caring for patients, storytelling is really at the heart of what we do every day. The act of understanding who a person is, what they have been through, why they are presenting to care, that at its heart is an act of story gathering and storytelling. As clinicians, we're trying to take medical history and medical evidence and turn it into a coherent narrative that makes sense to ourselves and that makes sense to our patients. But often this is not an easy task. So it's not easy to communicate effectively about health and science, in part because science by its very nature is messy. It's constantly being overturned. It's constantly being updated. Often when we see coverage of new science, it can look something like this. So everything you eat both causes and prevents cancer. Here we see that coffee, corn, eggs, and milk are all somehow both cancer-causing and cancer-protective. On the other side, you can see that you need somewhere between 5 and 10 servings of fruits and vegetables to live a long, healthy life, or maybe just kidding, it doesn't really matter at all. Now, one recent study found that half of new studies that are covered by newspapers are ultimately overturned or reversed by subsequent meta-analyses. And studies that get more coverage are more likely to be overturned than studies that got less coverage. And I should note that this study itself got a lot of news coverage, so I'm not sure what that says about the validity of the findings, but suffice it to say, it's hard to talk about issues that require a lot of nuance. Now, a second challenge in the way that we're communicating in medicine is that we in medicine tend to communicate in statistics, and most people tend to think in stories. And so in medicine, we try to avoid the use of anecdote, and that is entirely appropriate a lot of the time. One of the goals of evidence-based medicine is to use data and evidence, not anecdote, to drive decision-making. We sometimes poke fun at anecdote, thinking it's a waste of time compared to our facts and studies and statistics. But I do think that there's an important distinction that we need to make here, and that's between the use of anecdote to justify a particular practice or policy and the use of anecdote to explain or to promote that practice that's rooted in data. So you wouldn't want to necessarily use a collection of anecdotes to make evidence-based decisions or policy decisions, but you might want to use a collection of anecdotes to advocate for particular policy positions that are rooted in science and rooted in data, and it's important not to get those two things confused.